Welcome. I look forward to learning with you all today as we discuss the neurobiological relationship that exists between antisocial personality disorder and violent behavior, along with exploring how it can be applied to life and culture. So first, we are going to look at what is antisocial personality disorder. So antisocial personality disorder, which is also known as ASPD, is a cluster B personality disorder that consists of behaviors that are classified as antisocial, irresponsible, impulsive, or aggressive. So individuals who are exhibiting characteristic behaviors associated with ASPD are often thought of as being callous or unemotional, lacking empathy, and unable to form and maintain meaningful and lasting relationships. And they often have a complete disregard for the safety, rights, dignity, and well-being of other people. So who is most likely to have ASPD? So men are approximately 6 times more likely to develop ASPD than their female counterparts. And approximately 80% of those who are diagnosed with ASPD began exhibiting symptoms by the time they were around 11 years of age. And most adolescents exhibiting symptoms of ASPD are first diagnosed as having a conduct disorder. So what is neurobiology? So neurobiology is a field of study that focuses on the nervous system and other biological mechanisms that influence human behavior. So how do psychology and biology intersect, you ask? Well, psychology and biology intersect when perspectives and theories rooted in psychology are then used to form a correlation with the physical and biological causes behind human behavior, such as brain function, genetics, and nervous system function. So, who is the target audience? For this specific presentation, the target audience is forensic psychologists and criminologists who will be working with populations such as violent offenders or in a victim advocacy role. The information presented today and further research on this topic can benefit this audience by providing information that explains the relationship that exists between ASPD and violent behavior, along with treatment and intervention strategies, rehabilitation services that may reduce recidivism rates, and even encourage successful reintegration into society, and also cultural variables that must be considered when you're working with these populations. So now we'll look at some background information. So when was ASPD identified? George Partridge began the work of studying psychopathy in 1928. And then that work was furthered and continued by Hervey M. Cleckley, who continued narrowing down the definition of psychopathy and looking at its attributes and characteristics in 1941. It was a little more than a decade later, in 1952, The first edition of the American Psychiatric Association's Diagnostic and Statistic Manual of Mental Disorders was released, and it contained a disorder called sociopathic personality disturbance. It was like ASPD, but a little different in the fact that it focused more heavily on the psychopathy and the sociopathy than the actual personality disorder that causes those features and attributes. So then in 1968, that diagnosis was adjusted to include dissocial personality disorder when the second edition of the DSM was published. So finally, when the third edition of the DSM was published in 1980, the diagnosis was changed to antisocial personality disorder, and that became the umbrella that psychopathic features, sociopathic features, dissocial attributes, and most cluster B personality disorders are all kind of housed under that umbrella. So DSM-5 diagnostic criteria. So the American Psychiatric Association's DSM-5 outlines specific diagnostic criteria that must be met in order to be diagnosed with ASPD. So the diagnostic criteria that must be met includes a recurring pattern of behavior that shows a blatant disregard for the rights and safety of others, a failure to obey laws and maintain socially acceptable behavior that aligns with societal norms, lying or committing fraud for personal benefit or pleasure, an inability to control impulses, frequent aggressive or violent behaviors, chronic irresponsibility, like being unable to keep a job, an inability to feel remorse. So again, that's callous and unemotional. And then in addition to meeting those key pieces of diagnostic criteria, the individual must also be at least 18 years of age, and they must have shown characteristic behavior associated with a conduct disorder prior to reaching 15 years of age. So next, we will kind of look at historical opinions on ASPD and violent behavior. So overall, opinions and perspectives on the link that exists between ASPD and violent behavior have pretty much remained mostly the same. So research has shown that due to the common manifestation of aggressive behavior in individuals with ASPD, it makes it significantly more difficult to maintain positive or successful therapeutic and prognostic goals and outcomes. And these individuals usually face lengthy or even recurrent periods of incarceration due to a lack of impulse control, psychopathic and sociopathic traits that are characteristic of their disorder, and the prominence of comorbid substance use disorders. So now we're going to look at the actual neurobiology of ASPD. So studies that have been performed recently using neuroimaging have shown that ASPD is frequently comorbid with abnormal brain anatomy that includes white matter microstructure and gray matter deficits in the orbitofrontal cortex and dorsolateral prefrontal cortex. Further research exploring the causes for risky behavior and impulse control issues in individuals with ASPD collected data that indicated that in comparison to their peers without ASPD, individuals diagnosed with the disorder are at an increased likelihood of having significantly decreased axial diffusivity in the superior corona radiata, corpus callosum, anterior corona radiata, precentral and superior frontal blades, and fornix that, along with impaired modulation of the frontal cortex, may explain why these individuals struggle with inhibition and impulsivity. So some research using gene studies and generalized neuropsychological observation of participants previously diagnosed with antisocial personality disorder has provided quantitative evidence proving that this disorder and correlated psychopathic features are heavily influenced by genetics rather than external environmental factors. So ASPD is linked directly to deficits in memory, executive function, and attention, while individuals with ASPD who exhibit features of psychopathy also typically have deficits involving complex planning, impulsiveness, and inhibitory control. So one study utilized the Cambridge Neuropsychological Test Assessment Battery, and it was administered to a population of 85 male offenders with ASPD and 20 control participants who did not have a diagnosed personality disorder. So the results showed that 86% of those who exhibited features of psychopathy, and 89% of those who exhibited features of psychopathy actually met the DSM-5 criteria for an antisocial personality disorder diagnosis. So now we're going to look at treatment a little. So the most effective forms of treatment for antisocial personality disorder are psychotherapy, behavior therapy, and family therapy. Unfortunately, at this time, there are no medications that have been approved by the United States Food and Drug Administration for treating ASPD. So research on treatment approaches for ASPD has shown that while medication can be used to treat comorbid disorders, cognitive behavioral therapy would provide the client with the best results for improving quality of life and reducing the risk of aggressive or violent behavior. So next, we will talk a little about the neurobiology of violent crime. So first, brain function. So the amygdala, which is responsible for regulating fear and aggression, has also been implicated in having a direct impact on the likelihood of a person committing violent crime. So research using neuroimaging to study a group of men with decreased amygdala volumes and function provided evidence to suggest that these individuals were about 3 times more likely to exhibit characteristic violent behavior and psychopathic features than their peers with amygdala volume considered to be in the normal range, and that these amygdala deficits may be identified in children as young as 3 years old. So then when we think about people who may have a predisposition to violent behavior, we're kind of going to go back to, it being able to be identified in such young children. So children who are determined to be predisposed to violent crime later in life were placed in enrichment programs that focused heavily on developing and maintaining cognitive skills. And then when they went back and checked in on these kids later in the future, these individuals were determined to possess better brain function and were actually at a 34% decreased likelihood of committing violent crimes as a young adult. So next, we're going to look at the application to life. So first, I want to talk about the stigma of mental illness and violent crime. So many people associate mental illness with an inherent predisposition to violent behavior. And people have been conditioned by the media and societal biases to perceive mental illnesses as being dangerous and to fear those who are diagnosed with mental illnesses like ASPD. So, research related to the stigma of mental illness has shown that the societal perceptions of mental illness being dangerous has had a direct impact on the decreased amount of individuals who feel comfortable disclosing symptoms of a mental illness and seeking appropriate treatment, along with also adding to the discrimination that is faced by individuals with mental illness like ASPD. So next, we're going to look at recidivism rates for violent offenders. So when studying violent offenders, data collected from research focused on studying the anterior cingulate cortex of 100 male violent offenders suggested prisoners with deficits of the anterior cingulate cortex were twice as likely to reoffend after being released from prison than their peers who had normal levels of anterior cingulate cortex function. Next is how the relationship between ASPD and violent behavior can be looked at in relation to culture. So first, we're going to look at racial implications. Some of the cultural and racial implications associated with ASPD and violent behavior are perpetuated by stereotypes being applied that are harmful to communities of people that are already marginalized and oppressed. And research has shown that when media outlets cover violent crimes, in this case, we'll use mass violence as an example, like a mass shooting. They're more likely to portray Caucasian perpetrators of violent crime as victims or someone we should feel just deep sympathy for. We should be able to relate and understand. Yet they portray Black and Latino violent offenders as having an inherent predisposition to commit violent crime, which is untrue. So the next thing to look at is the impact of violent crime on society. So there are several different impacts that violent crime has on society, with one of the primary impacts being mental distress and diminished quality of life for victims and those who witness violent crime. So individuals who are repeatedly exposed to acts of violence have an increased likelihood of experiencing negative health outcomes, premature death, and sustaining non-fatal injuries. So research has shown that approximately 68% of individuals who experience sexual assault or other violent crimes were not provided with appropriate victim services, and they frequently experienced negative socio-emotional effects, such as feeling distressed or hopeless, having difficulty remaining engaged professionally and academically, difficulty maintaining relationships that existed prior to their assault, and even purposefully isolating and alienating themselves due to an inability to trust or feel close to others. Next is perceptions of mental illness and ASPD. So societal perceptions of mental illness and ASPD specifically are not only incorrect, but also cause direct harm to the groups of people they are perpetuated against. From our textbook, Biological Basis of Behavior, we're aware that there are many biological explanations for behavior that range from genetics, structural damage that has occurred to the brain itself, and even the role that chemicals and drugs have in causing disordered behavior. So finally, as this all applies to culture, we're going to talk briefly about cultural competence. So when you're working as a professional in the field of psychology, we are required to uphold and abide by the American Psychological Association's ethical principles of psychologists and code of conduct, which obligates us to maintain a standard of cultural competence when working with diverse populations. So according to Principle E, which outlines the respect a psychologist should maintain for the rights and dignity of those they work with, the American Psychological Association demands that psychologists be aware and respectful of individuals or communities that are vulnerable and should take all steps necessary to show respect for diverse cultural, racial, and role differences that exist within the populations they work with. And this can include, but is not limited to, race, ethnicity, gender, sexual orientation, religion, and even socioeconomic status. So, in conclusion, there is still a great need for more research exploring the neurobiological relationship between ASPD and violent behavior, as there are still many gaps that exist when we consider how to most effectively and efficiently identify this behavior early on, plan appropriate treatment strategies, and determine ways to reduce recidivism through rehabilitation and intervention. Continued research in this area will benefit several different populations and society as a whole. So those who will benefit the most would be clinicians and practitioners working with violent offenders, individuals diagnosed with ASPD or conduct disorders, and those who are working in a victim advocacy role that share a need to understand violent behavior at its biological base. So society still holds many misconceptions about the correlation between mental illness and violent crime. And a lot of these misconceptions are influenced by societal biases that have existed historically, combined with misinformation perpetuated in mainstream media, specifically in television shows and movies. The perpetuated stigma about mental illness and violent behavior has made it more difficult for individuals with disorders like ASPD to seek treatment, which actually increases the likelihood that they will commit a violent crime and spend significant time incarcerated. So the violent offender population as a whole would benefit from further research on the neurobiological relationship between ASPD and violent crime, as it will not only seek to provide more effective treatment strategies, but can also help to identify rehabilitation and intervention strategies that can help them learn to control their impulses, respond appropriately in social situations, and reduce their likelihood of reoffending after completing a period of incarceration. So I appreciate you taking the time to view this presentation, and I hope that you were able to learn at least one new thing during our time together today. If you have any questions or would like to learn more, please use the contact information that is included on the last slide of this presentation. I look forward to working with you all again in the future, and I hope you have a wonderful rest of your day. Thank you.